This practicum was at Vitas Hospice and Home Care located in Sebring, Florida. The need for pressure ulcers prevention project was identified through a review of organizational quality data and clinical observations, including an increased incidence of pressure ulcers among hospice patients. Analysis of incident report, chart audits, and quality dashboard reveals trends such as delay or inconsistent risk assessment, incomplete documentation, and variation in preventive interventions. Pressure ulcer preventions improve when a structural nurses care package are implemented. Those findings highlight gap between current practice and established evidence-based guidelines for pressure ulcer preventions. In addition, feedback from frontline nursing staff identified challenges related to workload, inconsistent use of standardized risk assessment tools, and limited adherence of prevention protocols. The need for assessment, you probably already figure out that the topic is about preventing pressure ulcers and appropriate documentation. What are my goals? Um, the goal is to prevent pressure injuries and improve patient outcomes by identifying and risk patients early using a standardized assessment, reducing the overall incidence through practice prevention, and standardizing interventions to ensure consistent evidence-based care across all units. We also aim to enhance staff knowledge and competence through ongoing training, improve documentation and communication to support coordinated care, and increasing collaboration among nurse, physicians, and assistants. So it is definitely a team collaboration. Ultimately, reduce wound care costs and treatment time by preventing injuries before they occur. Together, those strategies create a safer, more efficient, and higher quality for our patients, especially for hospice that are very at risk for developing pressures ulcers. How was the project implemented? We began by using standardized risk assessment tools to identify patients at risk of an admission and throughout their stay. As evidence support the importance of systematic risk assessment in preventing pressure ulcers. We developed protocols including regular repositioning, pressure relieving surveys, and proper skincare to ensure consistency across staff. And of course, education and training were provided through workshops and hands-on sessions to enhance staff knowledge and competency. We improved documentation and communication by using EMR and clear hands-off steps, ensure the team was aware of patient risk and care plans. IDG meetings discussing weekly to review high-risk patients and adjust intervention. This is hospice, meaning patients are mostly at home or in facility. Major barrier was that caregivers were not present at home during nurse visits. This prevents caregivers from learning how to prevent pressure ulcers. After discussing this issue with the team, it was determined that RN should accommodate the visit date and time when caregiver is at home or available at least by video calls. For the project outcome, well, the main outcome of our project focused on improving patient safety and care quality, and in hospice, I would say comfort. By implementing early risk detection, we can promptly identify high-risk patients and provide timely preventive interventions, helping reduce the overall incidence of pressure injuries. Staff ability is also improving through training on prevention techniques and proper documentation. Ensure that every intervention is carried out correctly. Finally, improving documentation and communications allow the care team to coordinate effectively, maintain accurate records, and ensure accountability, creating a safer and more efficient care environment for all patients at hospice. How was my project received by stakeholders? Well, initial reaction can be mixed, especially regarding documentation change. The project was well received overall. Nursing staff initially expressed concerns about increased documentation, like I said, but after implementation, they appreciated the clarity and structure of it provided. Management strongly supported the initiative because it aligned with patient safety goals and reduced the risk preventive injury. The improved documentation process improved accountability and continuity of care, eventually the benefit patients outcome. And the positive feedback include clear direction or risk assessment, or it was a little disorganized with this topic. Consistent repositioned schedule, that is something that was told to the caregiver and is very effective. Better understanding early skin assessment escalations, increased confidence and documenting care correctly. Initial concerns include, like I mentioned, perceived increase in documentation time. So now they have to spend more time doing basic because now they have to document more accurately and take more time doing it and workflow adjustments. So now if they were used finishing the basic in 1 hour, maybe now it takes them 1 hour, 20 minutes, depending on what they have to document. Who are the stakeholders? Well, in short, stakeholders include everyone involved in patient care, project implementation, comprehensive oversight, and those affected by outcome from frontline staff to leadership and patients. So, in more in detail, clinical staff that includes nurses, healthcare assistants, and physicians, management and leadership, team manager, case manager, general manager, and patients and family. How will it be sustained? To sustain a pressure agent prevention project is essential to implement consistent prevention rules into everyday clinical practice and support staff through ongoing education, leadership engagement, and regular monitoring. Story shows that when prevention protocols are established and supported by leadership, low pressure injury rates can be maintained long term, demonstrating the effectiveness of sustaining evidence-based practice. So it is important for daily practice, ongoing education, documentation and technology, leadership support, and interdisciplinary collaboration. Also, application plan that includes staff training, quality improvement method, and consistent adherence to best practice plans are related to improving continuing prevention outcome across diverse care settings. With that being said, regular audits and feedback loops help ensuring continued comprehensive and allow teams to adapt strategies over time, reinforcing those practices as part of organizational culture. Pressure injury prevention project will not be a one-time implementation, as it is designed to be part of an everyday clinical practice. Consistent protocols, ongoing staff education, electronic documentation, regular audits, and leadership support makes the intervention routine rather than optional. By implementing those practices into workflow, training new staff, and continuously monitoring outcome, the project becomes a sustained quality improvement initiative rather than a single effort. In other words, it is built into the system, so it continues over time, even as a staff or circumstances change. How did I perform and hand off for those next steps? Um, to ensure continuity of those projects in a hospice setting after my departure, a structured handoff was conducted, including clear documentation of prevention protocol, educational material, as PowerPoint that I created before, and outcome tracking tools delivered to the designated hospice nurse and interdisciplinary team. Evidence indicated that interactive, evidence-based educational intervention for hospice nurse staff significantly improved knowledge and clinical practice related to pressure ulcers prevention and care, underlining the importance of inserting education in the handoff process. So I created a staff, and the first one was identifying the responsible hospice team manager. There are several teams, but specifically in the team that I work, there is a manager, and she's the one receiving this. That would be clinical coordinator, case manager. The case manager are the nurses that are under her, and this is important because they will make sure that the care plan is implemented. Interdisciplinary team, as I mentioned, include nursing, aides, therapy, social working, and volunteer. And yes, volunteers and social workers, they can now do assessment, but families are good on reporting if they see any skin impairment to any visitor, including like chaplains, and they can communicate immediately to the nurse any concern that the family have. Document project for hospice care. So it's important that they document on every visit so the nurse that is coming, they know what was the fund and what is the plan. Handoff meeting. Um, we did a meeting saying I'm ending this and how it's gonna, what is the plan to continue with this project and ensure accessibility. So everybody have access to the PowerPoint I created and to the protocol that it was actually a betas before, only that nobody was basically implementing. Um, Additional research indicate that pressure injuries management remains a critical challenge at the end of life, and this is hospice, so they are at the end of life. By formally transferring the project documentation, education component, and monitoring framework to incoming hospice clinicians, the handoff prioritizes sustained quality improvement and aligns with the best practice prevention strategies in palliative care. Professional goals and the American Organization of Nursing Leadership competencies offer to achieve. According to the nurse executive competence achieved by the AONL, effective nurse leaders must demonstrate strong communication, collaboration, calculated thinking, and knowledge of the healthcare environment. In reflecting on those abilities, I have identified several strengths that support my development as a nurse leader. I excel at collaborative problem-solving and teamwork, actively engaging diverse stakeholders to ensure alignment and shared understanding of the project's goals. My communication skills allow me to clearly articulate expectations, strategies, and desired outcomes, which promotes transparency and accountability within the team. Moreover, I possess a solid foundation in the strategy management, allowing me to analyze objectives and develop efficient, cost-effective methods to achieve them. While those strengths position me well for leadership, I recognize that I need for continued growth, especially I am to extend my understanding of the involved healthcare industry landscape and expand my knowledge of legal and regulatory requirements to ensure comprehensive and high-quality care delivery. Also, I am committed to firming my leadership and management skills to become a more effective and transformational leader. I plan to incorporate this competency-based outline into my clinical and practical project by confirming adherence to regulatory standards, integrating current evidence-based practice, and fostering a strong communications and collaborations among stakeholders. I am confident in my ability to lead a project that is both sustainable and aligned with the organization's goals. Through development and implementing my project in hospice settings, I learned that importance on proactive, evidence-based care improving patients' comfort and quality of life. I gained a deeper understanding of how vulnerable hospice patients are to a skin breakdown due to, for example, immobility, nutritional change, and disease progressions, and how early assessment and consistent preventive interventions can significantly reduce risk. This project also supported my appreciation for interdisciplinary collaboration. A successful prevention requires coordination among nurses, aides, providers, and caregivers. I learned that communication and staff education are essential to ensure consistent practice and accountability. Additionally, I developed a better, consistent understanding of importance of regulatory submissions and documentation standards in sustaining quality improvement initiatives. From a leadership perspective, this experience enhanced my skills in project planning, skateboarding engagement, and strategic implementations. Most importantly, I learned that effective leadership in healthcare is not only about developing a plan but about empowering others, maintaining sustainability, and fostering a shared commitment to patient-centered care. This project reinforced my ability to lead change while remaining focused on compassion, efficiency, and evidence-based practice. Thank you, everyone. God bless you.